What do you mean by gestational diabetes mellitus? Gestational diabetes mellitus is carbohydrate intolerance of variable severity first diagnosed during pregnancy. It generally occurs in the second half of pregnancy. Now, why it is called gestational? It arises out of gestational or pregnant state due to exaggerated physiological changes in glucose metabolism, where maternal pancreatic beta cells fail to compensate raised demands. When does gestational diabetes appear usually? It usually appears after 24 weeks because pregnancy outcome in a woman where fasting hyperglycemia is diagnosed before 24 weeks is similar to that of overt or pre-gestational diabetes. Thus, fasting hyperglycemia early in pregnancy represents the prognosis of overt diabetes. Reasons for development of gestational diabetes mellitus. Insulin resistance increases from the second trimester due to pregnancy hormones, and glucose levels rise in women who do not have the enough pancreatic reserve for insulin production, especially in women with family history of diabetes and PCOD. Would you like to screen all pregnant women for gestational diabetes? Yes. Universal screening all pregnant women for GDM is now recommended by ACOG 2018. If selective screening is done, 50% cases of GDM may be missed. Southeast Asian women are an average risk of GDM, and Indian women have an 11-fold increased risk of developing GDM compared to Caucasian women. Universal screening is adopted in India at first antenatal visit. What is the period of gestation when screening should be done? There is lack of consensus on the period to start diabetes screening. At first antenatal visit, the first testing should be done during the first antenatal contact as early as possible in the pregnancies. In Indian context, Government of India 2018 and WHO 2016. ACOG 2018 suggests early pregnancy screening in overweight and obese women with additional risk factors. Now at 24 to 28 weeks. In absence of high prevalence or risk factor, screening is started at 24 to 28 weeks as suggested by IADPSG 2010 or ACOG 2018. What are the procedures of blood glucose measurement for screening of GDM? Screening is done by first one-step procedure and second two-step procedures. First one-step procedure. In this method, a standard oral GTT should be performed after overnight fasting by giving 75 gram of glucose. Plasma glucose is measured at fasting 1 hour and after 2 hours. In this case, fasting plasma glucose should be 92 to 125 mg per dl. 1 hour plasma glucose should be more than equal to 180 mg per dl, and 2 hour plasma glucose should be 153 to 199 mg per dl. Second, two-step procedures. In this procedure, 50 gram oral glucose challenge test is done first, followed by diagnostic 100 gram oral glucose tolerance test. If 1 hour plasma glucose becomes more than equal to 140 mg per dl. Now, criteria for diagnosis of gestational diabetes using 100 gram oral glucose tolerance test. In this test, fasting glucose should be 95 mg per dl, 1 hour glucose should be 180 mg per dl, 2 hours glucose should be 155 mg per dl, and 3 hour glucose should be 140 mg per dl. Two-step procedures is still recommended by ACOG 2017, but one-step procedure is mostly followed. Thank you for listening. Thank you.